Welcome back. Since September, the Blood Transfusion Service of Namibia has experienced a significant increase in patients needing blood transfusions. As it's currently experiencing a critical shortage of blood, leading the reserves to drop to 4 days of blood supply. To delve more on this, I'm joined by the spokesperson of the BTS of Namibia, Titus Shivute. Titus, good evening and welcome.
Good evening. Thanks a lot for having me, Nina.
Thank you so much for being here. Talk to us about what the current state of blood supply is nationwide, countrywide, Titus.
Yes, currently we are experiencing a critical shortage of blood. This is primarily due to increases in blood transfusions since the month of September, as you mentioned, and subsequently we haven't been able to attain the necessary targets from the blood drives that we've hosted over the same period. So this has led now to the current critical shortage, and it's really crucial that we build our reserves leading up to the festive season, when we synonymously also experience shortages due to increases in trauma incidents such as car accidents and stabbing incidents and so forth. So we are appealing to the Namibian public, any individual who is eligible to donate blood, to please come forward and do so, especially over the next week to 2 weeks, in order to help ensure that the lives of patients are saved.
What are the most common reasons, Titus, why people are unable to donate blood?
Well, there are quite a number of them. Many individuals obviously can't donate due to medical reasons, but commonly within our societies we found that there is actually a large portion of individuals that have a fear for needles. So as a result of that, they are not forthcoming with blood donations. There are also quite a large number of individuals who actually do not meet the criteria to become a blood donor. Criteria such as you having to weigh 50 kilograms, for example, within our given criteria. So there are a number of reasons that lead to individuals not donating on the day. Obviously, there are also various myths regarding blood donation within our society, and we try to educate individuals in order to get them to donate blood and commit to donating blood on a regular basis, to ensure that there is always an adequate supply available for those in need.
Does the blood transfusion service create awareness amongst people in the villages, for example, to donate blood?
Yes, we actually avail ourselves in our services to constituencies around the country. We go as far as Oshikango to host blood drives, and we are currently actually planning to set up a new blood donation center over the course of the next year in Rundu. And with that, we'll also be able to do mobile blood donation drives in locations around that demographic. We are also trying to spread as far as possible and encourage more young people to donate blood. And through this, we actually have agreements with the Ministry of Education for us to host blood drives at high schools in order to educate young learners for them to start donating at a very young age, and for them to understand the concept of blood donation from a very young age, in order for them to grow and continue being blood donors for the rest of their lives.
Talk to us about the initiatives that you're currently undertaking to address this critical blood shortage.
Yes, currently we are hosting blood drives in various towns across the country. This week we've done blood drives in Gobabis. We are planning to do blood drives in Karibib, Usakos, as well as Omaruru over the next week. But this current critical shortage needs to be addressed immediately. So this Saturday, the 11th of November, we will be hosting 2 blood drives, one in Windhoek and another in Nongwediva. So we'll be opening our head office in 35 Tal Street in Ospenplatz between 8 o'clock in the morning up until 2 o'clock this coming Saturday, in order to avail an opportunity for Windhoek residents who normally are unable to donate for one reason or another to do so this coming Saturday. We will also be having a blood drive at Marula Mall in Nongwediva between the hours of 9 o'clock in the morning up until 3 o'clock in the afternoon this coming Saturday. And I'd further like to extend an invitation to residents in Rehoboth to also donate this Friday, the 10th of November. We will be hosting a blood drive in Rehoboth at the Rehoboth Mall between 10 o'clock in the morning up to 3 o'clock in the afternoon, to also avail an opportunity to these individuals to donate blood. For our residents in Walvish Bay, you also have an opportunity to donate this Friday. You can donate at our center, which is just behind the Volvicha Medipark. Will be open between 10 in the morning till 3 in the afternoon. And we also have another clinic in Walvish Bay, which is the Walvish Bay Martial Arts or Sports Martial Arts, that will also be hosting a blood drive tomorrow. And this is basically all with the aim of us availing our services as far as possible around the country in order to avail an opportunity for those who are eligible to donate to do so at this critical time.
Mm-hmm. Is there a specific blood type which is most, in dire need of?
Yes. Currently, the blood types that we actually urgently need, or of which our reserves are critically low, are the O positive as well as the O negative blood type. This is primarily because they are the most compatible blood types, and in cases of emergencies, when there isn't enough time to, let's say, do a cross match between a donor as well as a patient, this is the blood that is administered to a patient. And not all medical centers around our country have the instruments to do compatibility tests, in which case they also administer the O positive or O negative blood types. So we are appealing to the public, all individuals listening with the blood types O positive as well as O negative, to really come forward and help to save the lives of patients such as mothers who bleed excessively during the process of childbirth. We have cancer and leukemia patients who are unable to produce enough healthy cells on their own and subsequently need transfusions. And moreover, the individuals involved in various trauma incidents such as the car accidents, the trauma incidents, and stabbing incidents that we often see in our societies.
Mm-hmm. You touched earlier just lightly on the criteria or restrictions for individuals who wish to supply blood or donate blood. Talk to us a bit about that.
Well, the criteria is quite easy. There are 5 basic criteria that we look at, and in order to basically evaluate whether someone is eligible to be a blood donor or not. First and foremost, you must be aged between the age of 16 and 65 years. Individuals who are aged 16 and 17 years old would require parental consent in order to donate, and you can still donate past the age of 65 provided that your doctor also gives you consent to do so. We also require each and every blood donor to weigh at least 50 kilograms. Primarily, this is because of the correlation between your body mass, how much you weigh, and the potential amount of blood in your body. So if you weigh 50 kilograms, the potential amount of blood in your body should be ranging between 4 to 6 liters. And we also require every blood donor to enjoy good general health. You must be healthy yourself in order to donate blood to someone who potentially is unwell at a hospital. Something as common as a cold or a flu can actually prevent you from donating blood. We also really want to encourage all potential blood donors to lead a sexually safe lifestyle. Your blood has to be safe in order to be administered onto a patient as well. And we obviously put this through a process to undergo all the various tests that are necessary. But we also have an expectation from the individual that's coming forward to donate blood to also know where they stand in terms of their status and that their blood is indeed safe for transfusion to a patient. And lastly, it's very, very important that you eat a substantial meal in the 3 to 4 hours prior to your blood donation, and drink lots of fluids after your blood donation in order to help your body replenish the blood that you've donated.
Yeah. Just finally, Titus, seeing that this is such a critical need and is urgent, are there any plans to collaborate with any organizations to address this blood shortage?
Yes, we are currently actually in the works in terms of launching our festive campaign on the 20th of November. We have been also hosting blood drives at various corporate, industrial, educational, as well as retail institutions around the country, and we are further extending our services to localities in and around the country. So for next week, as I mentioned briefly, we'll be hosting blood drives in Karibib, Omaruru, as well as Usakos, and thereafter we'll extend it to Grootfontein and Tsumeb, after which we'll also go to Chivarongo and Ocho. So we are really working firstly with the different constituencies and town councils in order to avail ourselves to all the different demographics within the country, and for everybody to be eligible to donate blood and help save lives this festive season.
Titus, thank you so much for being here this evening. It's always lovely having you.
Thank you so much for having me, and hopefully we'll get a lot more people to help save lives.
Indeed. That was Titus Shivute from the Blood Transfusion Service of Namibia speaking to us there. If you do notice the Blood Transfusion Service in your town,